Help Me Grow is a framework that brings together child-serving partners to improve early childhood services. We are a team that provides advice, guidance, programs, services, and helpful information for parents-to-be and families. It is part of a larger coalition of over 30 states that are related to the Help Me Grow National Center to promote early childhood systems to improve and provide innovative services for families with young children nationwide. Delaware's program begins prenatally and continues through age 8. This coalition of multifaceted persons focuses on supporting young children's healthy development by connecting families with community resources. It is not a standalone program, but rather a system model that utilizes and builds on existing resources to develop and enhance a comprehensive approach to early childhood systems building in any given community. Through comprehensive physician and community outreach and centralized information and referral centers, families are linked with needed programs and services. A child's early years are vital. They shape their entire future. Help Me Grow helps parents provide a safe and stable environment for that growth. Whether it is support, pregnancy help, or finding essentials like food or housing, Help Me Grow has the tools for parents to succeed. Help Me Grow is all about support. There is much to know when it comes to raising a child. If parents are in doubt, we can put their minds at ease.
So it's my great pleasure and honor to welcome you to today's Help Me Grow System event, which we have titled Help Me Grow Systems in Action, Connecting Our Early Childhood Communities, which is here. That's what we're trying to do today. My name is Paulina Jan, and I am the Early Childhood Comprehensive Systems Administrator at the Division of Public Health and the manager of Help Me Grow Delaware. So we are excited to have you all gather here today, especially since our in-person meetings are few and far between, okay? So I just wanted to ask a question. Can you show me by hand how many of you, when you hear Help Me Grow, think of Help Me Grow at 211? That is the call center. How many of you do think about that? Whoa. That's a lot. That's what we're trying to correct today. Okay. So, and it's not surprising because Help Me Grow at 211, they do the direct service of what we do. So that's the go-to, that's what you know. So we're just trying to with this today's event, we're trying to add more information to what you know about the Help Me Grow system. So through surveys and anecdotal feedback, we have heard from our constituents, that's you, that we need to do a better job at communicating what the Help Me Grow system is about. It's a system. So we are hoping that at the end of this session, the confusion or misunderstanding of what Help Me Grow stands for you will be a thing of the past. Okay? That's what we're hoping. So today's purpose is twofold. So as the event title indicates, our foremost goal is to demonstrate the interconnectedness of Help Me Grow activities and show how it contributes to Delaware's early childhood system. The other goal is to create a networking opportunity for early childhood providers such as you. And this is a Help Me Grow fidelity requirement that we need to do. So we're hoping that once you leave here, we'd have connected with, colleagues to help your programs. That's what we're hoping you'll be able to do today. So as adult learners, we know that being exposed to experience-rich and practical information increases our retention. So today, we're going to expose you to an interactive session of how Help Me Grow system operates in the state. So this way, it will have an experiential impact on you and lead you to encourage the families you serve to utilize the Help Me Grow system. That's why we're here. So for these reasons, we chose, instead of the usual PowerPoint that we normally would go to your facilities or programs to talk about Help Me Grow, we chose to deploy a simulation format, which will leave an indelible impression on your minds about the Help Me Grow system. I hope when you leave here today, you're not going to be the same about Help Me Grow, that you'll have a change of knowledge, attitude, behavior. So the simulation is an adaptation of the poverty simulation. How many of you here have participated in United Way's poverty simulation? Can you show by hand? United Way, okay, so the poverty simulation. So poverty simulation is just portrays the impact of poverty on families or individuals, right? But what we are doing here today, our Help Me Grow system simulation attempts to show how the Help Me Grow system works in Delaware. Okay, so this is our first time we're doing this, such a simulation. And I believe the first time any Help Me Grow affiliate, there are about 34 Help Me Grow states across the country. And it's our first time. So pardon me if we're using you guys as guinea pigs, right? So I hope you're okay with that. But that's what we're hoping to do. This is our first time. So what that means is that you provide us feedback as you go through the simulation for quality improvement. When we hear from you how it worked, then we can improve what we have. So the lessons learned from this session will inform our future sessions, because we have intentions of going downstage to do the very same thing, but we have to improve it before we can go elsewhere. So you are test pilots. Okay. So we have an engaging agenda for you. If you can take a look at your agenda. Okay, so we have the interaction. We're going to begin with an interactive session, and then we're going to have an overview and an impact of Help Me Grow, just add in more context to what you would have gone through when you're doing the simulation. And then we have a networking session. So thank you all for being here. Let's make the most of this opportunity to better understand the Help Me Grow system, connect and learn together. And without further ado, we're going to start with our first segment. And so please join me to welcome Daphne Evans, and Daphne is going to be our facilitator for today. Thank you.
I'll use this one for right now. Good morning. As Paulina said, my name is Daphne Evans, and I'm from DYE Consultant Training. I'm contracted to lead Books, Balls, and Blocks out in the community, and I also work at Christina Cultural Arts Center as the Family Service Coordinator. But I'm here today to be the game master. Are you ready to play a game? This game utilizes the 4 components of Help Me Grow. So the centralized access point, Help Me Grow at 211. The family and community outreach, which is primarily Books, Balls, and Blocks. Health provider outreach, and data collection and analysis. So I'm going to give some instructions, and then we're going to have a live demonstration of it. As you approach each station, you're going to go 1 card at a time. You're going to assume the persona on the card. It's going to give you a description, the person, what they're seeking, what information they may need to know. And you're going to approach that table, and they're going to respond to you just as if we were responding to someone asking us questions at a table or other places. So the demonstration is going to take place like this. Meet my friend Zoe.
So my card says, The mother of a 2-year-old boy, James, has his pediatrician for a routine 2 well child visit. Mom is concerned because she has noticed that James has limited eye contact and is not speaking full words yet. These concerns are causing her stress and anxiety because she's not sure what to do to help James. And then it has a location, and at the bottom it says which table to go to. So this one is health provider outreach scenarios.
Let's start this visit by we'll start with some measurements of James. We're going to get, his weight, his height. We're also going to be doing a developmental screen on James as well as an autism spectrum disorder screening. Okay. So inside of your packet, you'll actually have a copy of this, but this is a PEDS response form. It has a couple sample questions that would be asked if you did the PEDS screener. So you have that in your packet. Again, we'll also be doing the MCHAT. That's for autism spectrum disorder. We're going to give James a physical examination today. We'll also be doing immunizations for any shots that he's not up to date on. We're also going to be doing just a prick test for lead and, just make sure everything is okay with that as well. Okay? Okay. All right. So from this point, I'm going to go on to talk to you a little bit about the results. James's MCHAT results show possible signs of autism. It's nothing, you shouldn't be concerned. We're going to refer you to Birth to 3. Birth to 3 is not represented at this simulation, but they are in early intervention services for children birth to 3 years of age. They're going to do further evaluation of James and set him up for any services that he may need. In addition to referring you to Birth to 3, we're also going to be referring you to Help Me Grow. And the Help Me Grow table is going to be right over there.
Anything else that you need?
Now, with that, thank you. So Birth to 3 will do the more in-depth screening. They'll set up any services that might be needed for you. Is there anything else I can help you with?
Is there any community programs that can help? I'm having some stress and anxiety about this.
I have parenting classes. I also have different counseling services that might be able to help. Like that information?
Yes, please.
Okay. Anything else I can help you with?
Not today.
Okay. I'm going to send you over to the data table
Okay.
to make it find you some really good information about our services and going.
All righty. Wonderful.
Thank you.
So one thing that we can provide you with so we look at a lot of data for kids in Delaware. We look at Help Me Grow data. We look at overall indicators of well-being throughout the state. So your zip code, we do have a little profile that we can share with you today.
Wonderful.
Kind of just looking at general information that may be the background. And then we would be able to work with you and your family in a partnership to kind of curate some more zip code level specific data so that you can understand how your son may compare to the overall rates in your area.
Yeah, and as you know, one of the screeners that's used for diagnosing or screening for autism is the Modified Checklist for Autism in Toddlers, the MCHAT. And so we have data on that as well. So if you're ever interested in understanding, what percentage of children that are screened in my community, what percentage of them pass, what percentage fail, who are the providers in my community that screen for it, we have all that information as well.
All right. Thank you.
Okay, so Help Me Grow has helped me with being able to fill out the ASQ, Ages and Stages questionnaire for my little one because he's a special needs. But with the early intervention, we basically knew around 2 that there were some issues because we were doing the ages and stages of questionnaire in the increments of ages, the 0 to 2 months, the 2 months to 6 months. And then, so when he got around to the 18-month mark, we realized that he was struggling with speech and things like that. And so they really helped me to do that early intervention piece, which then led me to Birth to 3 to do the early intervention for him. He actually has autism. We've now realized that he has autism, but it was those early intervention pieces that helped us get there at an earlier rate before he entered school. They also helped me with connected me with a home visitor. So when he was also very young, we did home visiting with parents as teachers, and they came into the home and they did activities with him. They gave me other resources and to help to build his skills at a early age. He also, took him a while to roll over and crawl, and so they helped me with different skills to encourage him to do that. And they worked with him an hour in a week and at the home visiting. And so those were some of the things that I really found beneficial for me, would help me grow. I feel that Help Me Grow can help others with also with the books, balls, and blocks, with helping children meet their milestones and helping them fill out that ages and stages questionnaire that helps them to have that early intervention and to get them the resources that they need at an early age. And I feel like Help Me Grow also has the resource center that is really helpful for parents that are struggling with in many different areas with as far as light bills or getting their GED or first time home buyers and all those kinds of things that families are trying to do things to move forward and don't know where to go or how to do it or who should they call. And they really make those strong connections for families in the community. And if they don't have the answers, they know where to send you. And that's what families need. They don't know where to go.